Hello, today we're going to be covering the pharmacology for neurology. So we're going to start off with drugs for seizures, and I have grouped these into pictures that all incorporate the same MOA. So this first whole page, all of these mechanism of actions involve GABA, which I always represent with garbage, GABA garbage. So this whole picture here is one big scene. We're going to pretend that we are just kind of at some city. There's a barber shop, and then back behind the barber shop, we have the dump, the garbage dump, and the truck is trying to pick up the garbage. And then outside, we have some free entertainment in the street, and then we'll just kind of pretend that there's like a community pool over here. And there's some stuff going on in the water, and there's a mermaid in the pool, stuff like that. So we'll just go top to bottom. So, and these are not really in any particular order, but we'll start with these drugs where their MOA is to block the reuptake of GABA. So even though all of these pictures involve GABA, some of them augment GABA, some of them, like this one, blocks. So just pay attention. So the two drugs that block the reuptake of GABA are vigabatrin and tiagabine. So for this one, we have a garbage truck, and there's a vampire bat on the garbage truck. Vampire bat for vigabatrin. And then a tiger. The tiger is blocking the garbage truck, block reuptake of garbage. And obviously, like tiger, tiagabine, those are similar. And then so I lied. Just the tiagabine blocks the reuptake, and then this one inhibits the GABA transaminase. So just like how a garbage truck transfers garbage, this is going to inhibit like the transaminase of garbage. So adverse effects of the vigabatrin are fatigue. So we have the little Z's here, and somnolence, which is again like sleepiness, extreme sleepiness. So that's what the Z's are for. Weight gain, there's a little weight right there. And then visual field defects. So we have some glasses on the rims of the tires. Similar things over here, we have adverse effects of dizziness, and then that somnolence, and then general weakness. And then I think this was just a pro tip that these drugs are sensitive to the CYP3A4 reactions. That one only refers to tiagabine. So then we'll just move on to the barbershop. So this barbershop is representing phenobarbital, barbershop. And this one is going to be a augmenter of GABA and a CNS depressant. So just to make this simple, the term augments GABA just means it increases GABA. It makes it larger, so to speak, increases its effectiveness. And like I said, I represent GABA by garbage. And so in any picture that augments GABA, we have some garbage that starts really small, and then it kind of gradually gets bigger and bigger and bigger and gets augmented. Same thing over here. We have a little tiny piece of garbage here, gets bigger, 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 bigger garbage right here. So phenobarbital, outside of the shop, we have some, like I said, some free entertainment with a clown who's juggling some garbage, and then the Lorax, which is also vacuuming up garbage. And so all of these augment GABA. And then the barbershop, in addition, is a CNS depressant. So we just have this little street sign with some spine, like the central nervous system shown there. And there's a little sad face on the light pole because it's depressed. So CNS depressant. Adverse effects are sedation. So we have a seed for sedation in the window. And then mental dullness, which is not really shown in the picture. So next like I said, we have a clown for clonazepam or clownazepam or clownapin, and he's juggling garbage, so it augments GABA. We have abuse potential, sedation, and amnesia as adverse effects. So abuse potential is shown by an apple, abuse potential, apple. And then again, seed for sedation. And then this is American cheese for amnesia. Again, we have the Lorax for lorazepam, and he is vacuuming for Valium and vacuuming up the garbage. It again has the same adverse effects. And then just a note that this is the drug of choice, lorazepam is the drug of choice for status epilepticus. Moving on to our little community pool slash community lake, I guess you want to call it. We have a vulture standing on a diving board. So vulture for valproic acid. This augments GABA. And adverse effects are, I believe, all of these. Let me double check. So yeah, I just double checked my notes. Both valproic acid and this divalproic sodium, so a diving board for divalproics, they all have the adverse effects of nausea, weight gain, and then the hepatotoxicity. And then for gabapentin, so one of the pieces of garbage is a pen, so a garbage pen for gabapentin. And this also augments GABA and inhibits the secretion of excitatory neurotransmitters. So that's why there's a little an NT for neurotransmitter, and it's crossed out, it's being inhibited. And then gabapentin's adverse effects are sedation, abuse potential, and then vivid dreams. And then underneath the water here, we have this mermaid. Her hair was supposed to be colored green for, it was supposed to kind of look like kelp. So kelp for Kepra. And again, she's kind of swimming in this garbage. So augments GABA. Adverse effects are sedation. And this is commonly like your go-to drug in the ER. And then we also have pregabalin or Lyrica. So our mermaid here, she is singing karaoke. So there's lyrics on the screen for Lyrica, Lyrica. This augments GABA and also inhibits neurotransmitters. So again, there's a little NT that's crossed out on the lyric screen, the karaoke machine thing. Adverse effects are sedation, and then again, abuse potential, and also peripheral edema. So you can see these music notes are really large in this bottom part. So that's supposed to represent peripheral edema. So now we have more drugs for seizures, but this time all of the MOAs involve sodium. And these pictures are all kind of separate. They don't really go together. So we'll just start with our carbamazepine. So this is a loaf of bread, so carbs. And then there's one of those little mazes. So carb, maze, bean. This stabilizes sodium channels. So here we have sodium. Looks pretty stable in there. And then adverse effects are rash. We have rash, bone marrow suppression, sedation, and then SIADH, which is very important to remember. And then we also have oxcarbamazepine. So this ox got stuck in the carb maze. So ox in the carb maze. This is a sodium channel blocker. So because he got stuck in the maze, he's now blocking these channels. So he's a sodium channel blocker, which slows the transmission of impulses. Adverse effects are dizziness, so he looks pretty dizzy there. My bad. Nausea, vomiting, so we have a little vomit bag here. Nystagmus, his eyes look pretty wonky. They're nystagmic. Bone marrow suppression, so we have his bone sticking out here. Sedation, we have a seed. Again, the SIADH, which I think kind of just looks like the word sad, or like sad, and he looks sad. And also hypersensitivity, again, which I usually show by someone crying because they're overly sensitive and they just cry about everything. So that's your carbamazepine and your oxamazepine. Next, we have topiramate. So in this picture, we have some tapioca pudding. Someone tried to put some salt in it. And so because they tried to do that, like that's disgusting. I now have to throw away my tapioca pudding into the garbage because this is a sodium channel blocker. So we have sodium, there's an X here, it's blocking, sodium channel blocker, and then a GABA augmenter. So we have garbage, it's getting bigger and bigger and bigger, augments. Adverse effects are dizziness, which is shown here, sedation, paresthesia, so pins and needles. So we have a little thumbtack, like a needle, and then anorexia. We have this really skinny trash can to demonstrate anorexia. Over here we have this dinosaur with a really big toe and then a fossil of the toe. So phenytoin and then like a fossil, phosphenytoin. So a fossil of the toe. These increase sodium outflow and decrease sodium inflow. So we have increasing inflow, decreasing, I'm sorry, I just said that wrong. Increasing outflow, decreasing inflow. And then adverse effects are gingival hyperplasia. So this dinosaur has a really big smile, big grin, gingival hyperplasia, sedation, and then nystagmus, little wonky eyes here. Next is lacosamide. So we have a loco taco for lacosamide. And again, someone's trying to put salt on a taco, like, ew, that's not okay. So MOA, unclear, but it is a sodium channel blocker. So we're like, I'm gonna block that sodium. It's not going on my loco taco. Adverse effects are dizziness, vision changes, so he's got glasses on, nausea, vomiting, we have our vomit bag, behavior changes, and then hypersensitivity. So just a little tear here. The crazy eyes are just because he's loco, not because of nystagmus. And then last on this page is rufinamide. So this is demonstrating like, someone's being roofied. There's roofies, whatever, however you want to say that. And this is a margarita with some salt on the rim. Salt for, again, like a sodium channel blocker. And then adverse effects are suicidal behavior. So we have a noose here. Dizziness, if you think about if you've had too many margaritas, you're going to get super dizzy. And then that's somnolence. So Z's here. And then we just have a couple more drugs for seizures, but these ones just have sort of MOAs that aren't sodium channel blockers and they aren't GABA augmenters. So this first one is lamotrigine. So this is just a limo, a green limo so limo, lamo, and then trigine, green, lamotrigine. And this inhibits the release of glutamate. So I thought glutamate like glutes. So yep, those, you got some glutes on the window. No streaking in the green limo, okay? And then adverse effects are rash. So there's a rash on this rim here, dizziness, and then sedation. There's a seed on the rim. Another drug for seizures is ethosuximide. So here we have this kid, he's in school and he's learning about ethos, logos, and pathos, which we all hated learning about, I'm sure. And so he's like, ethos sucks. Hiccup. So this, we're unclear of the MOA, but it blocks calcium channels in the central nervous system. So over here, we have this little got milk, which I don't know about you guys, but those were like everywhere in my school, those little signs that were trying to encourage you to drink milk. And so calcium, I think milk, and then we have it crossed out because it blocks calcium channels. And then adverse effects are dizziness. So we have dizziness here. That's somnolence, so the Z's, and then hiccups, hypersensitivity, and then behavior disturbance. He looks pretty upset over something that's pretty simple. And then just a pro tip, this is the drug of choice for absent seizures. And so I think what's also helpful is that's common in adolescent children, and it's often when they're like sitting in class and they just look like they're not paying attention or daydreaming. So I think this picture is helpful to remember that as well. So now we're going to move on to drugs for Parkinson's disease. Actually, hang on, sorry, one more for seizure, and that is perampanel. So we have a ram wearing flannel. So ram wearing flannel. And this is a glutamate receptor antagonist. So again, look how big these ram's glutes are. He's got a big booty, glutes. And there's a big X here because we are antagonizing. We're blocking the glutamate receptor. Adverse effects are dizziness, this somnolence, and then behavior changes. So now we'll move on to Parkinson's disease drugs. So the first one is amantadine. So I think that looks like a man to dine. So we have dinner, they're dining, she's dining with this man, a man to dine. This is a antiviral, so this is a virus with an X through it. But the MOA is that it pushes dopamine out of the nerve terminals in the substantia nigra, and it is also a NMDA antagonist. So they are having dinner by Niagara Falls. So Niagara Falls for substantia nigra. And it's pushing dopamine. So we have this tree line here, but these are obviously dope leaves. And so they're being pushed along the falls, I guess. So dopamine. And then adverse effects are hallucinations. So she looks like she's hallucinating. Peripheral edema, it's not drawn very good here, but this is her foot and it's like ginormous compared to the rest of her peripheral edema. Orthostatic hypotension, anticholinergic effects, which are always like dry mouth, dry eyes, whatever. So lots of dryness. So that's why we have a cactus over here. Some other drugs for Parkinson's are, so in this picture, this is a museum. We have 3 pieces of artwork here. So 3 pieces of art for triphenylphenadiol. Brand name is Artane. So we have art, 3 pieces of art, so art. And then also one of the pieces of art is a bent pine tree. So it's benzing over, benzotropine or benztropine. Oh my gosh, I can't say this. Anyway, MOA is shown here. So this blocks acetylcholine from binding to its receptor. So acetylcholine blocks, they're in blocks of acetylcholine. And then our adverse effects are shown here. So again, dry eyes, dry mouth, urinary retention, and then constipation and confusion in the elderly. So we have a desert for all the dryness. Just some more drugs for Parkinson's. So in this picture, we have one of the 7 dwarfs from Snow White. This is Dopey. And he was in his little mine car here, cart car, and he's trying to get to the central nervous system. So Dopey leaves his car to cross the blood-brain barrier. So that's what's happening in this picture. Dopey has left his car, so levodopa, his carbidopa, and he's crossing the BBB, the big bad bridge, the blood-brain barrier. So the MOA is that carbidopa inhibits peripheral metabolism of levodopa. So it helps levodopa get into the central nervous system, just like how this little car here was helping Dopey get over here. Levodopa then metabolizes into dopamine in the central nervous system, which is what decreases in Parkinson's. Like in Parkinson's disease, you have decreased dopamine, so that's why we want to get this drug into the CNS. Adverse effects are movement disorder, orthostatic hypotension, and then hallucinations. So, I mean, if you remember from Snow White, he's dopey. I mean, he has movement issues. He's always tripping over his floppy clothing and stuff like that. So, movement disorder, his eyes, he's hallucinating here. And then I don't have a good way to remember orthostatic hypotension. That's another one. In this picture, so we have, this is kind of like Indiana Jones. He's got his whip with him, and he's, of course, digging up some artifacts. So the archaeologist needed his equipment or his rope. So he needed his equipment, his rope, his whip. So requip or rope and a roll in order to explore the crypt of two brothers. So brothers, bromocryptine. They're in a crypt. And so he dug 2 and then 3 holes, and then also discovered a mirror. So the mirror is for Mirapex. So he was looking for these skulls of these brothers in a crypt. First he dug 2 holes over here, and then he dug 3 holes over here. And that is because the MOA is that this is a D2, so dig 2, D2, D3 dopamine agonist. And then the adverse effects are somnolence, or disease here, sudden onset of sleep, hallucinations, edema, which I don't believe is shown, and then impulse control disorders, which I also wrote the whip. I'm not really sure why, to be honest. I guess you can control things with a whip. I don't know. So we'll move on. So we're still talking about drugs for Parkinson's, but this category is the MAOIs. So if you pronounce MAOI, it's kind of like Maui, sort of. So I either think like Maui, like the Hawaiian island, or like Maui from Moana. Again, like they all have MOs and A's in them. So I have Maui here. And just, yeah, so these are all monoamine oxidase inhibitors. So they inhibit the central nervous system metabolism of dopamine. So the drugs in this category are selegiline and then razagiline. So I have a seagull on a line. So seagull for seal, and then he's on a line, selegiline, and then some raspberries growing here, also like raspberries growing in a line for razagiline. Adverse effects are dyskinesia, which is not really shown, and then nausea. So still talking about drugs for Parkinson's, we have another class of drugs, and these are the COMT or catechol-O methyltransferase inhibitors. So So the two drugs in this category are talcopone, also known as Tasmar, or entacapone, or Compton. And so when I see the word comped, I think of a computer. And when I saw Tasmar, I thought Tasmanian devil, Tasmar. And then an entacapone sounds a lot like attack upon. So what's going on here is we have the Tasmanian devil playing chess on the computer. Pawn is like, so while he's playing, he's attacking the opponent's pawn. So entacapone and then delcapone. The cat here, he has a pet cat, is just to also help you remember that not only is like comped like computer, but like cat, Nicole. So anyway, these inhibit the secondary enzyme responsible for metabolizing catecholamines. Again, catecholamines. Adverse effects are dyskinesia. So I think that's why I have these squiggly lines here. He's kind of not moving around as well. And then nausea. Then I just wanted to mention like the order of Parkinson's drugs. So if you have a patient who comes in with Parkinson's, this is kind of what you want to start with and then what you would end with. So you would start with that amantadine. You would add an anticholinergic if they were having really bad tremors. If that didn't work, you would progress to your MAOIs. And then you could try a dopamine agonist or the levodopa carbidopa. And then if whichever one you picked, so if you just did a dopamine agonist, if that didn't work, then you could add the levodopa. Or if you started on levodopa and that didn't work, then you could again add a dopamine agonist. And then if those still weren't working, you would then progress to adding these COMT inhibitors. So switching gears again, we are now going to talk about drugs for multiple sclerosis. So the first class are interferons. And so here we have a virus wearing a bonnet who is operating an excavator. So excavator is for the brand name Xtavia, which is a beta 1B. So we have a beta here. And then we also have our beta 1A drug, which is the brand name Avonix. There's two brand names for each of these. So Avonix is one, and then Rebif is another. Same thing over here, Xtavia, and then Beta Cerone. But anyway, I just picked these brand names to help draw the picture. So the virus is wearing a bonnet, Avonix. And so the MOA is that they are immunomodulation antiviral-like properties. So that's why we have the virus here. Adverse effects are injection site reactions, flu-like symptoms. You could think of the virus and the flu. And then just kind of a side note, I don't have a picture, but the antispastic drugs for MS are your baclofen, diazepam, and your tizanidine. So actually, I can go over those right now because I believe they're the next picture. One of the next pictures, maybe not. Okay, here we go. So baclofen, if you remember, so this is a shark with a fin on its back. So baclofen, and the shark is swimming in garbage. So this is going to decrease the neurotransmitter release of GABA. So it's a GABA agonist. And then adverse effects are sedation. And then again, tizanidine. This is Tarzan, and he is walking two alpha dogs because it is an alpha 2 adrenergic receptor agonist. And then adverse effects are dry mouth, sedation, and then that's supposed to be hypotension. So those were those ones. And then diazepine we already covered. So those are just antispastic drugs for MS. Another drug for MS is this glatiramer. So I have a gladiator for glatiramer, and he's holding this myelinated sword and a wrench. So the wrench is because this is immune modulation. I think when you have a wrench, you're like modifying something or you're remodeling something. So modulation. And then surrogate for myelin. So that's why his sword looks like it's wrapped in these little like pool noodle things. It's a surrogate for myelin. And then adverse effects are just injection site reactions. Moving down here, we have the great Bob Ross, and he is using his favorite color, yellow ochre. So if you don't watch Bob Ross, you won't get this joke. But Bob Ross, every time he paints a picture, he always uses the color yellow ochre, that and phthalo blue. So anyway, ochre for ocrelizumab. And instead of holding a palette, he's holding a CD. So this is a monoclonal antibody against CD20 and an antigen on lymphocytes. Adverse effects are infusion reactions, activation of Hep B, and neutropenia. And so I feel like I didn't finish this drawing because I specifically remember I should have like a rash on him somewhere for infusion reactions, and then like a little hepatitis, whatever. So just use your imagination. And then moving on to this picture, it's bingo night at the senior citizen hall, and this dude who normally has a limp. So he normally has a limp, so right now he's riding on his little amigo thing. He gets bingo. And he's like, bingo, 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 B, B, B. And so he has to ride it because he has a limp. Normally, he has to ride all the way up to the front on his amigo to get his prize. So, bingo is for fingolimod. Fingolimod. And he has a limp because I think limp and lymph sound really similar. So, decreased lymphocyte penetration of the blood-brain barrier, BBB, bingo, bingo, bingo. And then reduced lymphocyte migration from lymph nodes. So this guy has a lymphocyte, and he has reduced migration, reduced mobility because of his lymph to get to the front. That is supposed to be analogous with the lymphocyte migration. Anyways, adverse effects are LFT elevation. So he is lifting his bingo card in the air, LFTs. Depression, even though he's got bingo, he's really sad. He's depressed. And then just decreased white blood cells. Next is teriflunomide. So we have this lady, she's bald, and she's holding up some tarot cards. And so the MOA is unclear, but it is a pyrimidine synthesis inhibitor, which may decrease lymphocytes in the CNS. So on these tarot cards, we have a pyramid here, pyramid for pyrimidine, and it's going to inhibit. So that's why there's an X. So a pyrimidine synthesis inhibitor, a big X through this pyramid, and then decreases, again, I'm going to say lymphocytes instead of lymphocytes. And so it's hard to tell, but this is a crutch on this card. So people who have a limp are like using crutches. And then the adverse effects are a headache. So she looks like she has a headache. Increased LFTs. She's lifting these cards, holding the cards, lifting them up. Diarrhea, neutropenia, hypersensitivity. So she's sad. Paresthesia, that's why we have our thumbtack. And then alopecia is why she's bald. So prednisone, we've covered it before. but it comes into play again as a helpful drug from MS. So these are corticosteroids are used for exacerbations of MS. You can also, in addition to prednisone, use methylprednisolone. So we have a predator for prednisone, and this is anti-inflammatory. It's going to reduce edema. And then adverse effects are steroid psychosis, which is not shown here, hyperglycemia, which is why we have a little piece of candy. And so that what I just said is what's in our notes for this module. In previous modules when we covered prednisone, it also has the adverse effects of sodium water retention, and then this was the MOA that was previously listed. Same thing with natalizumab. This is a previous drawing. And so I think natal, like neonatal lizumab. And so that's why I have like a little neonate here. And the MOA is that it is a monoclonal antibody against leukocytes. And so this is a white baby leuko. And then the only adverse effect that is listed in the PowerPoint for this module is that PML, progressive multifocal leukoencephalopathy. And the way that I kind of remembered that is that babies, when they come out, often just look like they have really big heads. They have encephalopathy. So that's pretty much all you need to know for that. Again, it's for MS. And so now moving on to some more drugs for MS. One more drug for MS, and that is mitoxantrone. Anyway, the whole point here, what I drew is that these two people are trying with all their might. So might. And they're playing kind of tug of war with this DNA strand, and that is because the MOA is that it is a topoisomerase 2 inhibitor. So topoisomerase is the enzyme that untwists DNA, and so topoisomerase 2, so there's two people, they're trying to untwist it, but they can't, they're being inhibited. And then again, so this is going to stop the RNA and DNA synthesis, which is why we have a DNA strand. Adverse effects are nausea, myelosuppression, hepatotoxicity, cardiotoxicity, and then anti-neoplastic and teratogenic. So now we're going to move on to drugs that are for headache. So I have them listed out here, and I will go over the drawings that I had previously. So we have simple analgesics, which are your acetaminophen, your NSAIDs, acetylsalicylic acid, which is aspirin, ibuprofen, naproxen, and then you have Excedrin, which is acetaminophen plus aspirin plus caffeine. You can use some opioid analgesics, although it's really not recommended, but you have the butorphanol, codeine, hydrocodone plus acetaminophen, oxycodone, and then just some others. So these ones I'm going to show pictures of. These ones I do not have pictures of. So Fluoricet is this butalbital plus acetaminophen plus caffeine, and that can be with or without codeine. So it'd be like Fluoricet with codeine or Fluoricet by itself. And then you have this fiorinol, I keep saying that wrong, it's fiorinol, and that is the butalbital plus aspirin plus caffeine. And again, I will show pictures of these, but for symptom control, so the nausea and vomiting that goes along with headache, you can use Thorazine or chlorpromazine, pyrazine or compazine, and then Reglan. And then for prophylaxis of the tension headaches, we have your Alavil and other tricyclic antidepressants, and then propanolol. So I'm going to skip around a little bit. Okay, so here is our NSAIDs. These are the same pictures as the last module, but just to recap. And the MOA wasn't listed in this PowerPoint. I'm going to try and go through them real quickly, just as a reminder. So aspirin, we have this aspirin tree. It is a COX-1 and 2 inhibitor. All of our NSAIDs are going to work somewhere on the COX-1 and 2 and inhibit that. So that's why we have some COX and chickens in here. And again, we're talking mainly about naproxen, ibuprofen. We have acetaminophen, which inhibits prostaglandin synthesis of COX-2 and 3. So we have a COX with a 2 and a 3 on it, and then like a stripper pole, like, because I don't know, that's related to prostitutes, and prostaglandin sounds like prostitute, that type of thing. And then all of our opioid analgesics are going to work on our mu, kappa, delta receptors. And then here are just the pictures to help you remember some of the names of these. You can pause the video and look at them more if you want to. Other drugs for headache, so that covers those. For the symptom control, so we have Thorazine, Compazine, and Reglan. So this is Thorazine. So this is Thor's hammer. It is a dopamine 2 antagonist. So that's why there's 2 dope leaves here. Dopamine 2 antagonist. It's got to be smashed, so antagonist. And then adverse effects are sedation and then extrapyramidal symptoms. So I have these little pyramids on here for pyramidal. Compazine is a dopamine antagonist as well. So compazine, again, we have a computer and there's a dope leaf on it for dopamine. Adverse effects are sedation and dystonia. And then we have Ronald Reagan for Reglan, and he's smoking a doobie, dopamine, dope, because it's a dopamine serotonin antagonist, and causes, adverse effects are listed there. Another opioid analgesic that I forgot to mention is this one, Stadol. So we have a doll that is being stabbed doll, Stadol. Again, it's a partial opioid analgesic, so it just works partially on the mu kappa delta receptors. And then prophylaxis for a tension headache, again, is this Alavil and then propanolol. Let me show those real quick. Close your eyes if you're dizzy. Okay. So Alavil is a tricyclic antidepressant. So we have Alavil, and there's a whole story behind this. He's desperate to get to Pamela. Those represent the other 2 drugs in this category. And he's riding on a tricycle to get to her. And on this tricycle, he's traveling southeast because it was a serotonin something or other, something like that. Anyway, has anticholinergic effects, sedation, and fatal in overdose. And then you can also use propanolol, which is a beta blocker, so a beta fish for beta blocker, and it blocks T4, the conversion of T4 to T3, which is why there's 4 blocks here and 3 blocks here. It's going to lower your heart rate, lower your blood pressure. So this is, in case you missed it, a propane tank for propanolol. So those are for prophylaxis of tension headaches. So getting back to our other pictures here, I'm going to start with this picture on the right. So these are our triptans, and these are going to be used for migraine acute treatment. So in this picture, this car is going on a trip down. And along the way, it's going to encounter a lot of stuff, which is going to help us remember all the drugs in this category. So the MOA is that is vasoconstriction of a serotonin, so 5-HT1 agonist. So let's start with the MOA of vasoconstriction. This road, as we go along farther and farther, looks like it gets smaller and smaller. It's constricting, so vasoconstriction. And then the serotonin 5-HT1. Well, the very first thing that this car comes to is one of those overpasses, and there's a warning sign that says that the height of the bridge is only 5'1". Height 5'1". So that helps you remember your MOA. The drugs in this category that have that MOA. So this car is traveling along, it's going on a trip, and it first comes across this really narrow bridge. So narrow for narrowtryptin. And then as it emerges on the other side, they come across a zoo for zoo or zolamitriptan. And then at the zoo is an elephant for elatriptan and a frog for fravatriptan. And then they keep going on this trip and they go all the way to Egypt and they pass the Great Pyramids of Giza. Giza for rizatriptan. And then they travel along some more, and eventually they come to the summit of a mountain. Summit for sumatriptan. So those are our drugs. And then the adverse effects are chest heaviness. So this is a treasure chest. It's heavy. So chest heaviness. And then a little thumbtack here for paresthesia. And again, this is for acute migraine management. Over here on the left, these are also for acute migraine management, but they're a different class. And so there's 3 drugs here. Let me first explain what's going on in this picture. So this person took an Uber to a rummage sale where they were selling lots of pants. They were selling lots of pants, and that's because they all end in pant. And so you have this guy wearing a toga, so a toga pant. And then he took an Uber to get here, so Uber for Uberogepant. And then he went to a rummage sale, rummage pant. The MOA for all of these is that it is a calcitonin gene-related peptide antagonist, which is abbreviated as CGRP. Now, that is shown in this picture by this box of Cheez-It grips. I don't know if you guys remember these, but they were a popular food, I guess, snack a couple years ago. So Cheez-It grips. So C for Cheez-It and then grip. So a grip antagonist. And then just say side note, so the CGRP causes dilation of blood vessels and releases inflammatory mediators. And so this drug is going to stop that and prevent, or not prevent, but help with migraines. Adverse effects are dyspnea and rash. So dyspnea is shown in this picture with these lungs that are hanging next to these pants. So dyspnea. Rash is not shown. Nausea is right here. And then there's somnolence. Both of these people are sleepy. Oh, sorry, I just realized what we have going on here. So R, they all have slightly different adverse effects. So the R, that's for your rimjapant. Its adverse effects are dyspnea and rash. That's why the lung is up here. It's close to the rummage sale sign. You could say that there's like a little rash here on the box. Both the Uber and the the atogopant have nausea and then somnolence and fatigue. So those are both similar. That's why they both have these. And then constipation is also on here. So he has the star for constellation. So constellation, constipation for atogopant. And there was some reason why I drew an ant on here. I don't remember. I guess we'll move on. Okay, these ones. So still talking about drugs for migraine management. We have our ergotamine derivatives. And so I think ergo or ergot sounds like ergonomics. So we have very ergonomic chairs, very curvy. So ergonomic for ergotamine. And then we also have these ergonomic water bottles. So this one's got those little grips in it for your fingers, very ergonomic to hold on to. 2 water bottles, 2 hydrating units. So dihydroergotamine. These are alpha 1 agonists. So we have a little alpha 1 here. They are going to have the adverse effects of vasospasm. That's what these little spasmy lines are. And then peripheral ischemia. So the peripheral leg of this chair has a clot in it. It's ischemic. Another drug for migraine prophylaxis and cluster prophylaxis is going to be this galanzimab. Galaximab. Galaxy. That's what I drew. Like intergalactic spaceship. They're having a war. So there's a monoclonal antibody against the CGRP. So we have this galactic spaceship firing flaming balls at this Cheez-It grip thing. So MAB against CGRP. Adverse effects are infusion reactions, dyspnea, and urticaria, which are not shown. And then we have for cluster prophylaxis, you can use lithium. So these are some lithium batteries. There are some D batteries. So they inhibit D receptor supersensitivity. They augment GABA, so it's garbage, and then downregulate NMDA. So mostly just what is shown here is just that if you remember, like these are D batteries and that they're lithium, and you remember it inhibits D2 and then garbage. You're not supposed to throw batteries in the garbage to augment GABA. Hopefully that'll help you remember this. Adverse effects are tremor. That's what these yellow lines are for. EKG changes. That's what these are for. These little spikes. Hypothyroidism. That's why there's a thyroid on here. And then polyuria and polydipsia. So there's 2 water droplets. So polydipsia, increased thirst. And then obviously if you're drinking more, you're going to be urinating more. So polyuria. Just some other notes about migraine prophylaxis. First, you want to avoid whatever triggers that you have. And then you can use valproic acid, which we covered in the beginning. That was the vulture on the diving board. You can use topiramate. That was our tapioca pudding. You can use amitriptyline, which I believe is the Elvis. Propanolol, your beta blocker. Verapamil, which is a calcium channel blocker, which I have a picture of and we'll show you in a second. Naproxen, which is an NSAID, and then Botox, which I also have a picture of. So let's go to verapamil and Botox. So here's Botox. So this inhibits chloride channels and prevents acetylcholine release from presynaptic neurons and then blocks nerve impulses. So hopefully, and adverse effects are injection reactions and then muscle paralysis. So hopefully this picture with this lady getting Botox in her face with the chloride and the acetylcholine on her eyes will maybe help you remember that. And then this is verapamil. So going back, this picture was from our cardio unit. So there are different types of calcium channel blockers. You have your two categories, your non-dihydropyridines and your dihydropyridines. So this pyramid is dyed and this one isn't. And then this is like aloe vera plant. So vera for verapamil. It's a calcium channel blocker. So it prevents calcium from entering cell membranes. And then adverse effects are dizziness, edema, headache, and constipation. And so now we're going to move on. That's all of our drugs for headaches. And so now all that's left to go through is our drugs for stroke. So CVAs. And these are all drawings from our hint module. The main ones we want to focus on are aspirin. So again, we have an aspen tree. There's these canoers, rowers with a coxman at the front. They are a reversible COX-1 and 2 inhibitor. Adverse effects are bleeding and bruising. Another drug for CVA is clopidogrel. And so when I hear clopidogrel, I think of clop, 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 the sound that a hoof makes, like on a horse when it's hitting the ground, clop, clop. This is a irreversible P2Y12 ADP antagonist, which is just, I just drew like this Y receptor thing. I don't know. Adverse effects are again bleeding and bruising. We also, I'm going to skip around because not all of these were mentioned. This dipyridamole and then dipyridamole plus aspirin are important. So we have a mole. He's by a pyramid. So that's your dipyridamole. And he's by a campfire because it inhibits cyclic AMP, campfire, cyclic AMP. And so the MOA for this one is just that plus whatever's aspirin's MOA, and that is for CVA prophylaxis. Other drugs for prophylaxis are on the next page. So we have warfarin, which we have these little soldiers that are going to war. They inhibit vitamin K, so vitamin K antagonist. Adverse effects are bleeding and bruising. You want to watch out for your drug-food interactions, and then monitor INR, which should be between 2 and 3. So that's why there's kind of like 3 people here. And next we have rivaroxaban or apixaban. So pix, so this is a pixelated picture, and then there's a river, so a pixelated river, apixaban, rivaroxaban. And these are going to be your anti-10A. So we have 10A here. Adverse effects are bleeding and bruising. We also have dabigatran or Pradaxa. And so dabigatran, I thought sounded like one of the Transformers, like Megatron. And it's a 2A for an antithrombin. Adverse effects are again bleeding, bruising, and GI. And then we can also use, going back to this picture, some low molecular weight heparins. So enoxaparin and dalteparin. Enoxaparin, I have a wand here because in Harry Potter, the term nox is like what you would say when you want to turn out basically the flashlight of your wand. I know it's nerdish, but whatever. And then I just like dalteparin looked like Dallas, Texas. Dalteparin. And these bind to antithrombin. Adverse effects are, so that's Antithrombin is 10A. And then also I have over here binds to 2A. Cell bleeding and bruising, and these are good for DVT prophylaxis. Going back to this picture, one important thing, last drug I'm going to go over is our TPA, or tissue plasminogen activator. So that is shown in this picture here. Just to read what I have in our notes, this activates the clot dissolution cascade. And then right here I have activates plasmin. Adverse effects are bleeding, bruising, hemorrhagic conversion. And a note, if a person comes in with an ischemic stroke, you want to use this within 3 hours, but up to 4.5 hours from the time of symptom onset. So just to explain this picture more, we have two PAs in a plaza dancing the mambo. And these are thrombolytic drugs. So we have two PAs. That's why they have stethoscopes. So PA, his arms look like a T. And another drug, which we didn't talk about, is RPA. So her body looks like it's in the shape of an R. Anyway, they're dancing the mambo because these are thrombolytics, and they're in a plaza for plasmin. Adverse effects are bleeding. There's a bloody fountain over here. And then again, just the newer version of TPA is TNK, but we didn't really talk about it that much. So that is all the drugs to go over for neurology. Hopefully that was helpful.